You're probably well aware of how annoying it can be when you wake up in the middle of the night. You turn over and try to go back to sleep. But for some reason, your mind just won't shut up. And this happens almost every single night at exactly 3 a.m. So what is going on? Is there any real explanation behind this? Well, it turns out that many seniors deal with this exact same problem, and they've been dealing with it for a long time without even realizing it. It's a very common experience, but not a lot of people talk about it because they feel embarrassed. However, doctors and sleep experts are actually very interested in this issue and have uncovered some surprising findings. After researching the brains of countless sleepers, scientists have found multiple reasons that could explain why you keep waking up at 3 a.m. In fact, there are so many possible causes that we were going to explore all of them in today's video. So make sure to watch until the end if you want to know everything about this phenomenon. Also, before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button or hit subscribe. Thank you. And let's begin. As it turns out, nighttime awakening is something that affects millions of Americans every single year. It can happen to people of all ages, but it's especially prevalent among seniors. That's because as we get older, our bodies become more susceptible to various medical conditions that can seriously affect our sleep patterns. Sometimes, this can simply be attributed to an uncomfortable mattress, or perhaps too much caffeine during the day. But if you're someone who's always waking up at 3 a.m. and you're pretty healthy, then there's most likely another explanation. The first one is something called sleep apnea. Sleep apnea is a condition where your breathing repeatedly stops and starts while you're asleep. This happens because the throat muscles relax too much and block the upper airways. And since your brain doesn't get enough oxygen, it wakes you up briefly. Most people don't end to realize they have sleep apnea unless they're sleeping next to someone who hears their loud snoring. But even then, some people with sleep apnea don't snore at all. The only way to know for sure is by visiting your doctor and getting tested. The good news is that there are treatments available which can greatly improve your sleep quality. Another explanation is something called restless leg syndrome. Restless leg syndrome makes you feel an irresistible urge to move your legs, usually accompanied by uncomfortable sensations. The symptoms typically start when you're lying down and trying to fall asleep, causing you to toss and turn for hours. There are medications that can alleviate these symptoms and allow you to get more rest. But just like with sleep apnea, restless leg syndrome is a condition that becomes more prevalent as we age. The next reason is something far less tangible, and that's grief. Grief is a natural human response to loss, but it can sometimes take a toll on our sleeping habits. If you've lost a loved one recently, or maybe you're feeling nostalgic for simpler times, this could be manifesting itself as a desire to wake up at 3 a.m. This may seem strange, but there's actually scientific evidence to support this claim. A study conducted by the Walter Reed Army Institute of Research found that soldiers who had experienced recent trauma were more likely to wake up during the early hours of the morning. It's theorized that this happens because our brains process emotions while we're sleeping. And if there's unresolved issues or trauma from the past, it can interfere with our ability to rest. Now, moving on to something much more sinister. There's also the possibility that something dark is lurking in your closet. Yes, we're talking about the classic horror movie trope of the closet monster. In all seriousness though, there could be something else lurking in your closet that's causing you to wake up. At 3 a.m., studies have shown that as we get older, we become more and more afraid of the dark. This fear can be so intense that it physically manifests itself as a nightmare, complete with an irrational fear of monsters or intruders. Scientists believe that this fear is rooted in our primal instincts for survival. As we age, we become more aware of our own mortality, and this makes us more vulnerable to certain psychological tricks. Our minds play on our fears and use them to keep us awake, even if there's no real danger present. Alright, now let's talk about something that's a little bit more light. Did you know that you can actually be dreaming about food? It's true. And it can happen so vividly that you wake up believing that you actually ate something. This is called dream hunger, and it happens because our brains process memories while we're sleeping. So if you've been craving a particular dish lately, your subconscious mind might be trying to tell you something. Maybe you need more of that food in your diet, or perhaps it is just a sign that you should treat yourself to a nice meal. Either way, dream hunger can be a fun way to explore your subconscious thoughts and feelings about food. Just don't rely on dreams alone when deciding what to eat. Another possible cause for nighttime awakening is something called circadian rhythm sleep disturbance. This occurs when your internal biological clock, which regulates sleep and other bodily functions, becomes misaligned with the actual 24-hour day. As we age, our circadian rhythms can become less stable, leading to difficulty falling asleep at regular times and frequent awakenings during the night. This is why many seniors prefer to take naps during the day. It allows them to catch up on sleep that they weren't able to get at night. However, scientists have found a way to combat this issue through something called chronotherapy. This involves taking medications at different times of the day in order to reset your biological clock. While it may sound like something out of a science fiction movie, chronotherapy is a real treatment plan that has been shown to be effective in helping people with circadian rhythm disturbances sleep better. Another potential reason is that you're drinking too much water before bed. While staying hydrated is important for overall health, drinking too much water close to bedtime can disrupt your sleep. Frequent trips to the bathroom can interrupt your sleep cycle, making it difficult to fall back asleep. It's recommended to limit fluid intake in the evening and avoid caffeine and alcohol consumption before bed, as these substances can increase urine production and further disrupt sleep. Alright, now let's explore something a little more unusual. Our past lives. Sounds crazy, right? Well, some experts believe that there could be more to life than what we remember. They think that we may have lived many lives before this one, and each life comes with its own set of memories and experiences. According to this theory, when we die, we're reborn into a new body and a new time period. Some people even claim to remember fragments of their past lives through something called past life regression therapy. During these type of therapy, individuals are guided into a deep state of relaxation and asked to recall memories from previous lives. While there's no scientific evidence to support the existence of past lives, some people find comfort in the idea that they may have lived many lives before this one. Perhaps you're re-experiencing fragments of a past life, and that's why you keep waking up at 3 a.m. Who knows? While all of these explanations are purely speculative, they serve as interesting theories as to why you may be waking up at 3 a.m. Ultimately, if you're concerned about your sleeping habits, it's best to speak with a medical professional. They'll be able to assess your individual situation and provide guidance on how to get a better night's sleep. Now, if you're still not convinced about any of these explanations, there is one last thing to consider. Aliens. Okay, we're kidding. But seriously, if none of the other options make sense to you, then maybe it is time to start looking up in the sky a little more often. That's because some conspiracy theorists believe that aliens might be behind our nighttime awakenings. They say that aliens use advanced technology to enter our minds and control our thoughts while we're sleeping. While this sounds like something from a science fiction movie, there are a few instances of people claiming to have encountered aliens during sleep paralysis. Sleep paralysis is a temporary inability to move or speak while falling asleep or waking up. Some people experience hallucinations during sleep paralysis, including the sensation of seeing or feeling an alien presence in their room. Of course, there's no concrete evidence to support these claims, but it is an interesting theory nonetheless. Also, keep in mind that this video is meant for informational purposes only, and is intended to diagnose or treat any condition. If you suspect you may have a medical issue, we highly encourage you to seek professional help. Now let's dive into the topic. Sleep disturbances, especially those occurring in the early hours of the morning, can be caused by a variety of factors. Certain health conditions can disrupt sleep patterns, leading to frequent awakenings. One such condition is sleep apnea. Sleep apnea is a breathing disorder that occurs when a person's breathing repeatedly stops and starts during sleep. This can cause a person to briefly wake up every time their breathing is interrupted. This can happen many times throughout the night without the individual being aware of it. As a result, the person may feel extremely tired and fatigued during the day. The severity of sleep apnea can vary, and it is often categorized into 3 types: obstructive sleep apnea, central sleep apnea, and complex sleep apnea. Obstructive sleep apnea is the most common form and occurs when the muscles in the throat relax too much, causing the airway to become blocked or narrowed. Central sleep apnea, on the other hand, occurs when the brain doesn't send the proper signals to the muscles that control breathing. It's important to address sleep apnea promptly, as it can lead to serious complications if left untreated. One of the most significant risks associated with sleep apnea is its impact on cardiovascular health. Studies have shown that individuals with untreated sleep apnea have a higher risk of developing cardiovascular diseases such as coronary artery disease, heart attack, and stroke. This is because sleep apnea can cause the heart to work harder, leading to high blood pressure and other cardiovascular issues. Another condition that can cause frequent awakenings is heart problems. Heart conditions such as angina or congestive heart failure can make it difficult for a person to breathe comfortably, especially while lying down. This discomfort can lead to frequent trips to the bathroom at night and disrupt sleep patterns. Furthermore, chronic pain can also disturb sleep and lead to early morning awakenings. Conditions like arthritis, nerve pain, or injuries can cause discomfort and stiffness, making it challenging to fall back asleep after being awakened. However, it is important to note that not everyone who wakes up at 3 a.m. will have underlying health issues. Sometimes it can be a sign of mental health concerns, such as anxiety or depression. These conditions can cause a person's mind to race, making it difficult to focus on sleep. Anxiety can also trigger hyperventilation, which can lead to disrupted sleep patterns and early morning awakenings. For instance, if you have an upcoming presentation at work or an important exam, you might start feeling nervous and anxious. This heightened state of alertness can make it difficult to relax and fall asleep. And if you do fall asleep, your anxiety might cause you to wake up abruptly in the middle of the night. Similarly, depression can cause significant disruptions in sleep patterns, leading to insomnia or hypersomnia. This means that individuals with depression may struggle to fall asleep or stay asleep, often experiencing early morning awakenings. The emotional and psychological distress associated with depression can make it challenging to achieve the deep, restful sleep necessary for overall well-being. In addition to anxiety and depression, certain medications can also contribute to early morning awakenings. Stimulants, diuretics, and corticosteroids are among the most common culprits. Stimulants such as those used to treat ADHD can increase alertness and make it harder to fall asleep. Diuretics, which are used to eliminate excess fluid from the body, can cause frequent urination, disrupting sleep patterns. Corticosteroids, on the other hand, can cause a range of side effects, including insomnia. If you suspect that a medication is causing your early morning awakenings, it's essential to speak with your healthcare provider. They may be able to adjust your dosage or switch you to a different medication that has fewer side effects. Certain lifestyle habits can also play a role in disrupting sleep and contributing to early morning awakenings. One common habit is consuming caffeine late in the day. Caffeine has a half-life of 5 to 7 hours, meaning that it can still be in your system, keeping you alert by the time you want to go to bed. Another habit that can interfere with sleep is eating a heavy meal close to bedtime. Large meals can cause discomfort and indigestion, making it harder to fall asleep and stay asleep. Additionally, consuming alcohol before bed, while it may initially promote sleepiness, can disrupt sleep patterns later in the night, leading to early morning awakenings. Furthermore, using electronic devices in bed can also contribute to sleep disruption. The blue light emitted from these devices can suppress melatonin production, making it harder to fall asleep. Engaging with mentally stimulating content on screens can also make it difficult to relax and unwind before bed. Waking up at 3 a.m. can be a de-stressing experience, but understanding the potential causes can help alleviate some of the anxiety surrounding it. While certain medical conditions and medications can contribute to early morning awakenings, it's important not to overlook the potential impact of mental health and lifestyle factors. If you're someone who frequently wakes up at 3 a.m., it's worth considering whether stress, anxiety, or depression might be playing a role. Managing these mental health aspects through therapy, lifestyle changes, or medication can significantly improve sleep quality. Additionally, examining your lifestyle habits can provide insight into your sleep disturbances. Reducing caffeine intake, especially late in the day, avoiding heavy meals before bed, and limiting screen time can all contribute to a more peaceful night's sleep. Moreover, establishing a consistent sleep schedule can be immensely beneficial in regulating your body's natural sleep-wake cycle. Going to bed and waking up at the same time each day, even on weekends, can help reinforce your body's internal clock, making it easier to fall asleep at night and wake up in the morning. Creating a relaxing bedtime routine is another effective strategy to promote better sleep. This could include activities such as reading, taking a warm bath, or practicing gentle stretches. These rituals can signal to your body that it's time to wind down, making it easier to fall asleep and stay asleep. While it's normal to wake up occasionally during the night, Persistent early morning awakenings can indicate an underlying issue that requires attention. By understanding the potential causes and making necessary lifestyle adjustments, you can pave the way for a more restful and rejuvenating sleep. No. 1. You're experiencing a mental health issue. Anxiety and depression are two of the most common mental health issues that can cause difficulty sleeping. According to Healthline, anxiety can make it hard to get your mind off the stressful thoughts racing through your head, which prevents you from falling asleep in the first place. Similarly, depression can cause insomnia by disrupting your normal sleep patterns and making it difficult to stay asleep. This is backed up by research published in the Journal of Affective Disorders. The study states that people with mood disorders like depression often have abnormal sleep patterns, such as having trouble falling asleep or staying asleep. But the reverse can also be true. That is, trouble sleeping can also contribute to mental health problems. For example, there's a well-established link between insomnia and depression. In fact, insomnia is one of the most common early symptoms of depression. This is because the neurotransmitters that regulate sleep, such as serotonin and norepinephrine, are also involved in mood regulation. So when you have trouble sleeping, it can disrupt the balance of these neurotransmitters, which can lead to feelings of depression. It doesn't matter whether the insomnia came first or the depression. Both conditions can worsen each other and form a vicious cycle. This is why it's important to seek help if you're struggling to sleep, as it could be an early sign of a more serious issue. Fortuna. Teli. There are effective treatments available for both insomnia and depression that can help you get the rest you need. If left untreated, both of these can take a toll on your overall health. So what are some things you can do to prevent this from happening? One way to reduce the risk of developing mental health problems is to find healthy ways to cope with stress. Exercise, yoga, meditation, and spending time in nature are all great options. It is also important to build a strong support system of friends and family members who can offer emotional support when you're feeling down. Another thing you can do is to limit your exposure to social media. Studies have shown that too much social media use can increase feelings of loneliness and depression. Instead, try to focus on building real-world relationships. Finally, don't be afraid to seek professional help if you're struggling. A therapist can teach you coping mechanisms and provide medication if necessary. Don't let mental health problems keep you up at night. Take action today to protect your mental health and get the restful sleep you deserve. No. 2. You have a medical condition. There are a number of medical conditions that can make it difficult to sleep at night. These include chronic pain, asthma, allergies, acid reflux, Parkinson's disease, restless leg syndrome, thyroid disorders, and kidney disease. Each of these conditions can cause discomfort or disrupt the body's natural sleep-wake cycle, leading to difficulty falling or staying asleep. For example, chronic pain can make it difficult to fall asleep because the body is constantly in a state of alertness. Likewise, asthma and allergies can cause respiratory problems that make breathing difficult during sleep. Acid reflux, on the other hand, can cause stomach pain and discomfort, which can also make it hard to sleep. Parkinson's disease can cause tremors and muscle stiffness, leading to an uncomfortable night's sleep. Restless leg syndrome makes it difficult to keep still, especially at bedtime, and can also cause sleep disturbances. Thyroid disorders can affect the body's internal clock, leading to insomnia. And finally, kidney disease can cause excessive urination at night, which can break up the sleep cycle and make it hard to get a good night's rest. If you suspect that a medical condition is keeping you up at night, it's important to see your doctor for a diagnosis and treatment. Once the underlying condition is under control, it should be easier to get a better night's sleep. However, there are several medical conditions that may seem unrelated to sleep, but can actually have a significant impact on your ability to sleep at night. One of these conditions is sleep apnea, which is a serious sleep disorder that causes the person to stop breathing repeatedly during sleep. This can cause loud snoring and pauses in breathing that last for more than 10 seconds. Sleep apnea can cause daytime drowsiness and fatigue and can also lead to high blood pressure, heart disease, and stroke. Fortunately, there are treatments available for sleep apnea, such as continuous positive airway pressure therapy, which can help to improve sleep quality and reduce the risk of serious health complications. Other medical conditions that can affect sleep include gastroesophageal reflux disease, or GERD, which can cause stomach acid to flow back into the esophagus, leading to difficulty swallowing and chest pain. Also, overactive bladder, which can cause frequent urination, especially at night, making it difficult to sleep. To get a good night's sleep, it's important to rule out any underlying medical conditions that could be contributing to your sleep problems. With the help of your doctor, you can identify and treat any medical issues that may be keeping you up at night and get the restful sleep you need. And no entres, you ave nocturia? Have you ever found yourself getting up to pee in the middle of the night? You're not alone. In fact, about 1/3 of adults over the age of 30 experience this condition known as nocturia is defined as waking 2 or more times to void at night. While this can be annoying and inconvenient, it can also be a sign of an underlying medical condition. So if you're frequently waking up to pee at night, it's important to pay attention. One common cause of nocturia in older adults is an enlarged prostate. An enlarged prostate can block the flow of urine, making it difficult for the bladder to empty completely. This can cause urine to back up into the kidneys and make them work harder than they should. Over time, this can lead to kidney damage. Another cause of nocturia is a condition called overactive bladder. Overactive bladder occurs when the muscles in the bladder wall contract involuntarily, causing leakage of urine. This can happen when the bladder is not full, leading to frequent urination. Additionally, as people get older, the bladder's capacity can decrease. This means that the bladder cannot hold as much urine as it used to, leading to a more frequent need to urinate. Several factors can contribute to this decreased capacity, including an enlarged prostate, overactive bladder, and weakened pelvic floor muscles. When the bladder's capacity decreases, the person may find themselves urinating more frequently, including at night. Fortunately, there are treatments available to help manage nocturia. For example, medications can be used to relax the muscles in the bladder, make it easier to urinate. In addition, lifestyle changes such as drinking fluids during the day and avoiding caffeine and alcohol before bed can be helpful. If you're struggling with nocturia, don't hesitate to reach out to your doctor for help. By working together, you can find the right treatment to help you get the restful sleep you need. While occasional interruptions in sleep may not be cause for concern, frequent nighttime awakenings can be a sign of an underlying issue that needs to be addressed. If you're finding yourself consistently unable to sleep through the night, it's important to consider the various factors that could be contributing to your sleep problems. Mental health issues such as anxiety or depression, medical conditions such as sleep apnea or nocturia, and lifestyle habits such as caffeine consumption or late-night snacking can all play a role in disrupting your sleep patterns. Fortunately, there are steps you can take to address each of these potential causes and get the restful sleep you need. Managing mental health concerns, making lifestyle changes, and seeking medical treatment when necessary can all help you get back on track towards a more peaceful night's sleep. Remember, prioritizing your sleep is essential for your overall health and well-being. So don't hesitate to reach out to a healthcare professional if you're really struggling to get the sleep you need. With the right support and treatment, you can overcome your sleep problems and enjoy better rest. Nocturia. Another common factor is the frequent need to urinate at night. As people get older, the bladder's capacity can decrease, and conditions like an enlarged prostate or overactive bladder become more common. This often leads to nighttime bathroom trips, with 3 a.m. being a typical wake-up time for many. However, if you are someone who wakes up consistently around 3 a.m. and finds yourself unable to go back to sleep afterward, it could be more than just a late-night thirst. So what exactly is going on? Why does this happen? Before we dive into the potential underlying causes, it is important to consider that the experience of waking up at 3 a.m. can vary greatly from person to person. Some may find that they wake up abruptly and feel refreshed, while others might slowly drift awake, feeling groggy and disoriented. Understanding these different experiences can help pinpoint the root cause. One prevalent theory suggests that our biological clocks play a significant role in these nocturnal awakenings. Our bodies operate on a circadian rhythm, a roughly 24-hour cycle that regulates sleep-wake patterns, hormone release, and other essential functions. For those whose internal clocks are set to wake up earlier in the morning, 3 a.m. might fall within their lightest sleep phase, making it easier to rouse. This natural fluctuation in energy levels could explain why some seniors wake up feeling alert and ready to start their day, even if it's in the middle of the night. However, biological clocks aren't the only internal factors at play. The condition known as sleep apnea can also disrupt sleep and lead to frequent awakenings. Sleep apnea is a sleep disorder characterized by pauses in breathing during sleep, which can occur several times a minute. These interruptions in airflow can cause a decrease in oxygen levels, triggering the body to wake up briefly. While many people with sleep apnea are unaware of the nightly disturbances. Their bed partners often notice them due to the characteristic snoring and sudden gasps for air. If left untreated, sleep apnea can lead to excessive daytime sleepiness, irritability, and other complications. As we age, our bodies undergo various changes that can contribute to these nocturnal interruptions. One common change is the weakening of pelvic floor muscles, which can result in more frequent urination. This increased need to use the restroom, especially at night, can cause disruptions in sleep patterns and lead to waking up around 3 a.m. Additionally, an enlarged prostate, which is more prevalent in aging men, can also obstruct the flow of urine, leading to incomplete bladder emptying and heightened urinary frequency. Another age-related factor is the decline in kidney function. As our kidneys become less efficient at removing waste and excess fluids from the body, it can lead to fluid retention and increased urination. This can be particularly problematic at night when the body tries to eliminate excess fluids while we sleep. The combination of weakened pelvic floor muscles, an enlarged prostate, and reduced kidney function can make nighttime bathroom trips a regular occurrence, often disrupting sleep and leading to waking up around 3 a.m. Now let us talk about how you can figure out the real reason behind your persistent 3 a.m. wake-ups. To begin, it's crucial to keep a sleep diary. This should include details about your bedtime, wake-up time, any nighttime awakenings, and the quality of sleep you're getting. Such a record can reveal patterns and insights that can point towards the root cause. Next, pay close attention to your bathroom habits. Note the number of times you visit the restroom each day, especially at night. If you're finding yourself making frequent trips to the bathroom, it could be a sign of an underlying issue, such as an overactive bladder or enlarged prostate. It's also essential to be mindful of your fluid intake, particularly in the hours before bedtime. Drinking fluids close to bedtime can increase the likelihood of nighttime urination and subsequent awakenings. Try reducing your fluid intake in the evening and see if it makes a difference to your sleep schedule. Observing your sleep environment can also provide valuable clues. If you share a bed with a partner, ask them to note any instances of loud snoring or sudden movements during sleep. These could be signs of sleep apnea or restless leg syndrome, both of which can lead to nighttime awakenings. While these steps can help identify patterns and potential issues, it's essential to consult with a healthcare professional for a proper diagnosis. A doctor can perform a physical examination, review your medical history, and order any necessary tests to determine the underlying cause of your 3 a.m. wake-ups. Once the root cause has been identified, your doctor will work with you to develop an appropriate treatment plan. Depending on the diagnosis, this might involve lifestyle modifications, medications, or other therapies. If your frequent 3 a.m. wake-ups are due to an overactive bladder or other urinary issues, your doctor may recommend pelvic floor exercises, bladder training, or medications to help control urination. For those with sleep apnea, continuous positive airway pressure, CPAP therapy is often the primary treatment. CPAP involves wearing a mask that delivers pressurized air while sleeping, ensuring that the airways remain open and preventing interruptions in breathing. In addition to these treatments, there are also some general strategies that can aid in improving sleep quality and reducing nighttime awakenings. Establishing a consistent sleep schedule, getting regular exercise, and creating a relaxing bedtime routine can all contribute to better rest. Moreover, avoiding caffeine and alcohol, especially before bed, can help minimize disruptions in sleep patterns. Addressing the underlying causes of persistent 3 a.m. wake-ups is crucial not only for improving sleep quality, but also for maintaining overall health and well-being. By understanding the various factors that can contribute to these nocturnal interruptions, including age-related changes, biological clocks, and sleep disorders, we can take proactive steps towards finding effective solutions. Through a combination of lifestyle modifications, medical treatments, and self-care practices, it's possible to minimize nighttime disturbances and wake up feeling refreshed and ready to tackle the day. Waking up at 3 a.m. might seem like a simple quirk at first, but consistent experiences of this can indicate deeper health issues that need attention. From altered biological clocks to conditions like sleep apnea and age-related urinary problems, there are several factors that could be at play. Sleep apnea, in particular, deserves attention because its symptoms often go unnoticed by the sufferer. If left unaddressed, this condition can lead to fatigue, mood swings, and even serious health complications. Regular 3 a.m. awakenings might be your body's way of telling you that something isn't right. So it's important not to dismiss these occurrences as just a quirky part of your sleep routine. Instead, pay attention to these patterns, consult a healthcare professional, and take the necessary steps to address the underlying causes. Improving sleep quality is not only about addressing immediate concerns, but also about investing in your long-term health and well-being. As we age, it's natural to experience changes in our sleep patterns. However, persistent 3 a.m. wake-ups might be signaling more than just a shift in our internal clocks. By understanding the potential causes and taking proactive steps to seek help, we can ensure that our nighttime interruptions lead us towards better rest and better health. If so, this video will provide insight into why it happens and what you can do about it. Trust me, understanding the underlying causes will empower you to take control of your sleep once again. So let's explore the mysteries of the 3 a.m. awakening together. By the end of this video, you will have a clear understanding of the reasons behind these nocturnal interruptions and practical tips to address them. Remember, knowledge is the first step towards better sleep and overall health. So if you're ready to reclaim peaceful nights, keep watching. We'll delve into the scientific studies and expert opinions that shed light on this common yet perplexing issue. You won't want to miss out on this informative journey. Numerous studies show that frequent 3 a.m. awakenings are widespread among the elderly, affecting approximately 55% of individuals aged 65 and above. Waking up at this time can be distressing, leaving many seniors questioning why it happens and how to stop it. It's essential to understand the underlying causes to address this problem effectively. In this video, we will discuss several factors contributing to this phenomenon, allowing you to gain insights into your own situation and find potential solutions. One prevalent theory suggests that the disruption of sleep at 3 a.m. is linked to the natural decline in hormone production associated with aging. As we age, our bodies undergo significant hormonal changes that can impact sleep patterns. For instance, melatonin, the hormone responsible for regulating sleep, decreases with age. Lower melatonin levels can disrupt the body's circadian rhythm, leading to early awakenings and difficulty falling back asleep. This hormonal shift explains why many seniors experience lighter, shorter, and more fragmented sleep. Additionally, other hormones such as growth hormone, testosterone, and estrogen also decline with age, which can affect sleep quality and contribute to nighttime disturbances. It is important to recognize that these hormonal changes are a normal part of the aging process and can significantly impact sleep patterns. Understanding this connection between hormones and sleep can help seniors make adjustments to their lifestyle and seek appropriate medical advice when necessary. Furthermore, it's worth noting that not all individuals will experience 3 a.m. awakenings due to hormonal changes. However, for those who do, addressing these changes through hormone replacement therapy or lifestyle modifications can sometimes help restore better sleep. It is crucial to consult with a healthcare professional to determine the best course of action and rule out any underlying medical conditions. While hormonal changes can be a contributing factor, it's essential to consider other possible causes as well. These can range from underlying medical conditions to medications or simply poor sleep habits. Therefore, a comprehensive approach that includes evaluating medical history, current medications, and lifestyle factors is necessary for an accurate diagnosis and effective treatment plan. Another compelling explanation for frequent awakenings at 3 a.m. lies in the realm of brain activity. Research indicates that during this time, the brain undergoes a shift in wave patterns, transitioning from deep sleep to lighter stages. Specifically, it's been observed that around 3 a.m., the brain exhibits increased alpha wave activity, which is typically associated with wakefulness and relaxation. This change in brainwave patterns can disrupt sleep continuity, causing individuals to wake up or experience lighter sleep, leading to more frequent awakenings. Additionally, certain brain regions become more active during this time, including the prefrontal cortex, which is involved in cognitive functions such as decision-making and attention. The activation of these areas may contribute to the feeling of alertness, making it challenging to fall back into a deep sleep state. Furthermore, age-related changes in brain function and connectivity could play a role in these 3 a.m. awakenings. As we age, there's a natural decline in brain activity, but disruptions in the communication between different brain regions can occur, potentially leading to sleep disturbances. Understanding the neurobiological basis of these awakenings can provide valuable insights for developing effective strategies to promote better sleep hygiene and manage nighttime disturbances. by recognizing the specific brainwave patterns and regional activations associated with 3M awakenings. Researchers and clinicians can work towards developing targeted interventions. These may include cognitive behavioral therapies, neurocognitive stimulation, or even pharmacological approaches to help individuals maintain deeper sleep and minimize interruptions. Further research in this area is crucial to unravel the complexities of 3 a.m. awakenings and pave the way for more effective treatments. Moreover, it is essential to consider that not everyone will experience 3 a.m. awakenings due to changes in brain activity. However, for those who do, addressing these issues through proper sleep hygiene practices and targeted interventions may help restore better sleep quality. Consulting with a healthcare professional or sleep specialist is recommended to explore personalized strategies and rule out any underlying medical conditions. While brain activity provides an intriguing perspective, it's important to consider other potential explanations for 3M awakenings. These can include factors such as sleep disorders, medical conditions, and lifestyle habits. Sleep disorders like sleep apnea can cause breathing interruptions during sleep, leading to awakenings. Medical conditions such as restless leg syndrome can also contribute to nighttime disturbances. Additionally, lifestyle factors such as caffeine consumption or irregular sleep schedules can disrupt sleep patterns and lead to more frequent awakenings. Therefore, a comprehensive approach that considers both brain activity and other potential causes is essential for a complete understanding of this phenomenon. By taking a holistic view, researchers and clinicians can develop more effective strategies to address 3 a.m. awakenings and promote better sleep quality. Furthermore, it's crucial to remember that not everyone will experience 3 a.m. awakenings due to sleep disorders, medical conditions, or lifestyle factors. However, for those who do, it's important to seek professional help to manage these issues. With proper treatment and lifestyle modifications, many individuals can find relief from nighttime disturbances and improve their overall sleep quality. Consulting with a healthcare provider or sleep specialist is recommended to develop a personalized plan that addresses specific needs and concerns. While the interplay between brain activity, sleep disorders, medical conditions, and lifestyle factors provides valuable insight into 3M awakenings, it's equally important to explore the role of the environment. Factors such as noise, temperature, and lighting can significantly impact sleep quality and contribute to nighttime disturbances. Research shows that environmental factors can influence brainwave patterns and hormone levels, ultimately affecting sleep continuity. For example, exposure to noise pollution has been linked to increased cortisol levels, a stress hormone that can disrupt sleep. Similarly, variations in room temperature can affect the body's ability to maintain a comfortable sleeping environment. These environmental influences can also interact with individual differences in sleep, chronotype, and underlying health conditions, leading to unique challenges in achieving restful sleep. To mitigate the impact of environmental factors, it's essential to create a conducive sleep space. This includes minimizing distractions, maintaining a quiet and dark room, and using comfortable bedding and pillows. By optimizing the sleep environment, individuals can better manage 3 a.m. awakenings and promote uninterrupted sleep. Additionally, exploring the use of white noise machines, earplugs, or blackout curtains may help create a more relaxing atmosphere and minimize external disruptions. Understanding the interplay between environmental factors and sleep can empower individuals to take proactive steps in managing 3 a.m. awakenings and improving overall sleep quality. In conclusion, addressing the issue of 3 a.m. awakenings requires a multifaceted approach that considers various factors such as age, hormonal changes, brain activity, sleep disorders, medical conditions, lifestyle habits, and environmental influences. By understanding the complex interplay of these factors, individuals can take proactive steps to manage their sleep and minimize nighttime disturbances. Implementing good sleep hygiene practices, seeking professional help when necessary, and creating a conducive sleep environment are crucial aspects of addressing 3 a.m. awakenings. Moreover, staying physically active during the day, avoiding caffeine and alcohol before bed, and establishing a consistent sleep schedule can significantly improve sleep quality and reduce interruptions. As research continues to advance, new insights and interventions will emerge, offering hope for better sleep and improved quality of life for those frequently awakened at 3 a.m. Remember, Knowledge is the first step towards better sleep, and by understanding the causes of 3 AM awakenings, you can take control of your sleep and wake up feeling refreshed and rejuvenated. Sweet dreams. 3 AM and you're awake. No big deal, right? You hit the snooze button and drift back to sleep until your alarm goes off a few hours later. It happens to all of us from time to time, but for many seniors, it becomes a nightly occurrence. And not only are they up at 3 AM, but staying awake for the rest of the night. If you're a senior who finds yourself suddenly awake in the middle of the night with no obvious cause, this could be a sign of a serious problem. So let us get to the bottom of this mysterious 3 AM wake-up call and uncover what it means when you and seem to go back to sleep once you've been awake for over an hour. The first thing you need to know is that the aging process itself causes some major changes in your sleep architecture. These changes include less time spent in deep sleep and more time spent in lighter sleep. As you enter your golden years, your brain begins to produce less of the neurotransmitter called acetylcholine, which regulates the transition between wakefulness and sleep. This means that you may find yourself waking up more frequently throughout the night, especially during the early morning hours. Your sleep cycles naturally shift earlier as you age, causing you to wake up earlier as well. According to the National Institute on Aging, most older adults wake up around 6 AM, even without the aid of an alarm clock. If you're someone who typically wakes up at 6 AM every morning, going back to sleep after being awake for an hour or two in the middle of the night can be difficult. The natural dip in your sleep cycle that occurs between 3 and 4 AM may leave you feeling wide awake and unable to fall back asleep. Fortunately, there are steps you can take to address these issues and improve your sleep quality. But before we dive into those solutions, let us look at why waking up at 3 AM is more than just a quirk of getting older. There are several medical conditions that can cause frequent nighttime awakenings. Restless leg syndrome, or RLS, is one such condition that affects millions of Americans. This disorder causes uncomfortable sensations in the legs, such as tingling, crawling, or aching, which can make it difficult to fall asleep. People with RLS often find themselves waking up at night and are unable to return to sleep until the symptoms subside. Sleep apnea is another common cause of disrupted sleep. This condition causes the muscles in the throat to relax, blocking the airway and causing pauses in breathing during sleep. These pauses in breathing can cause you to stop sleeping, even if only for a few seconds. Over the course of a night, this can lead to significant sleep disruption and excessive daytime sleepiness. Other medical conditions that can disrupt your sleep include chronic pain, asthma, acid reflux, diabetes, depression, and anxiety. These conditions can cause physical discomfort or emotional distress that can interfere with your ability to fall asleep and stay asleep. Now let's talk about how much sleep you really need. The amount of sleep you need each night can vary depending on several factors, including your age, lifestyle, and overall health. However, most experts agree that 7 to 8 hours of sleep per night is ideal for most adults. As you enter your golden years, you may find that you need slightly less sleep. According to the National Sleep Foundation, most older adults need 7 to 8 hours of sleep per night. But it's important to note that some individuals may require more or less sleep depending on their individual needs. Some seniors may find themselves getting by on just 5 or 6 hours of sleep per night, while others may need 8 or 9 hours. It's essential to listen to your body and determine how much sleep you need to feel rested and alert during the day. Getting too much or too little sleep can have negative consequences for your health and well-being. So aim for 7 to 8 hours and adjust based on your individual needs. Let's face it, we've all tried counting sheep at one point or another when we can't fall asleep. But did you know that there are other techniques that can help you get back to sleep faster? One approach is to practice relaxation techniques, such as deep breathing exercises or progressive muscle relaxation. These techniques can help calm your mind and body, making it easier to fall asleep. Another option is to distract yourself by engaging in a mentally stimulating activity such as reading a book or solving a puzzle. This can help take your mind off any thoughts that may be keeping you awake and allow you to drift back to sleep. It's also important to ensure that your bedroom is conducive to sleep. Make sure it's dark, quiet, and cool to promote better sleep. You may also want to consider using blackout curtains, earplugs, or a white noise machine to minimize distractions and help you fall asleep faster. And if you still can't fall back asleep after trying these techniques, it may be helpful to get out of bed and do something relaxing, such as listening to soft music or gentle stretches. Just be careful not to do anything too strenuous, which could make it harder to fall asleep. You may also want to try setting a specific bedtime and sticking to it as closely as possible. This can help regulate your body's natural sleep-wake cycle and make it easier to fall asleep at night. Additionally, avoid using your bed for activities other than sleeping, such as watching TV or working, as this can make it harder to associate your bed with sleep. If you're struggling to fall back asleep after being awake for a prolonged period, don't panic. Try relaxation techniques, distractions, or other strategies to help you get back to sleep. We've covered a lot of ground so far, but the truth is that there's still a lot more to know about the 3 a.m. wake-up call. In fact, recent research suggests that this seemingly random occurrence may be an indication of something much more serious. A study published in the journal Current Biology found that most people experience a temporary lapse in the quality of their sleep around 3 a.m. This lapse occurs due to a shift in the brain's activity, specifically in the suprachiasmatic nucleus, or SCN. The SCN is a group of neurons in the brain that regulates the body's internal clock, controlling sleep-wake cycles and other bodily functions. During the 3 a.m. shift, the SCN temporarily slows down, causing a brief period of reduced sleep quality. This can result in light, slow-wave sleep, leaving individuals vulnerable to being woken up by external stimuli. However, this phenomenon appears to be more prevalent in individuals over 65 years old. This finding suggests that the 3 a.m. wake-up call may be a natural occurrence in older adults rather than a sign of a medical condition. But it is important to note that while this study sheds light on the biological mechanisms behind the 3 a.m. wake-up call, it doesn't account for other potential causes such as medical conditions or medications. That's why it is always important to consult with a healthcare professional if you're experiencing persistent sleep disturbances. After all, it is not uncommon for older adults to have difficulty falling back asleep after waking up in the middle of the night. In fact, a study published in the Journal of Clinical Medicine found that nearly half of community-dwelling adults, aged 65 and older, reported experiencing sleep disturbances. The study also found that women and those with certain medical conditions such as arthritis were more likely to report sleep problems. Despite these findings, it's important to remember that not all cases of 3 a.m. awakenings are benign. Conditions such as sleep apnea, restless leg syndrome, and other medical problems can cause nighttime awakenings. Therefore, it's crucial to consult with a healthcare provider to rule out any underlying medical causes. Sleep is an essential component of good health and well-being, and it's important to prioritize sleep and take steps to improve sleep quality. If you're a senior citizen who's constantly waking up at 3 a.m. and struggling to get back to sleep, it's worth speaking to your doctor to identify the root cause and explore potential treatments.